Hey everyone, and welcome back to another episode of Kick Off Your Damn Heels. I am Dr. Teralyn, and I have my friend and colleague Adrienne Klein on the other end. And I just love sharing on the spotlight with her because she's super fun, and we always have a good time when we do this, right? So today we're gonna talk about hair tissue mineral analysis. So first of all, Adrienne, let everybody know who you are and what you do.
Adrienne Klein. I'm a certified nutritionist and I work exclusively with thyroid patients. We work together. I use the hair analysis with almost all of my clients and to really drill down and build a nutrition plan based on the hair analysis results. And a lot of times it really helps eliminate those symptoms that are lingering even though you're on medication. So the inability to lose weight, still not sleeping through the night, joint pain, fatigue, all those kinds of things.
All right. So just as a side note, Adrienne is going to be doing the hair tissue mineral analysis. I'm going to get that right on me. And yes, and we are actually going to follow it as kind of a journey. So I will be doing some live stuff with her when my results come back. And to prove it, here's what she sent me in this nice little pink thing. And here is my sample ready to go, sealed up for her.
It's always a little bit more hair than you think it should be. Just putting that out there.
All right. So do we want to talk about the hair part?
Let's talk about the hair part because you actually are the first person to
freak out about it.
Yeah, I work with thyroid patients who, lose their hair all the time. So, and I have not had someone say, oh my gosh, there's no way I'm cutting hair from my head. Where else can I get it?
Okay. So I have to back up a little bit because of my whole thyroid thing, which I talk about all the time. I had significant hair loss and especially on the sides here. So when my hair was about this long, I took a picture of like a selfie. I was feeling good and I took it and you could see straight through my hair. It was that thin on the sides. And I thought, holy shit balls. What am I going to do? That's terrible. Like, cause my hair is important to me and I've always had nice thick hair until this whole thyroid thing kind of hacked it, and I've had difficulty growing it, period. So what I had done was I put in hair extensions in the sides and grew my hair out for 2 years. Now, when I talked to you, I had just gotten my hair extensions out. It was at a point where I was like, I don't need these anymore. My hair is still long. It's about here. So it helped me grow it out. And I was still insecure because the extensions made it a lot thicker. And so taking them out, it felt like I was practically bald and nobody could tell except me. And then you're like, you got to cut your hair down to the scalp. And I was like, oh, hell no. And I was like, what am I going to do? And I'm like, I got to go to the hairdresser. Maybe she can pull it from different spots all over my head. And I panicked. I freaked. And
I thought you were joking at first, but then
I wasn't.
You were not joking.
I was not joking because I was like, what? I'm like, look, what am I going to do? Like, I want to get this done, but I don't want to cut my hair because I spent so much time getting it to a place where I liked it and didn't need the extensions anymore. And it just felt. And then she's like, you got to cut off your hair. And then I saw the directions and they're literally cutting out like a circle of hair. And I'm like, my ponytail is already only this big around. What am I going to do? So, okay. So this is like going to be TMI. So I said to Adrienne, I said, so where else can I take some hair from? Yeah.
I said, don't tell me.
But then you said, but I'm going to have to get it approved just to be sure.
That's true. I did.
So I won't tell anyone where the hair came from. It just didn't come from here.
Your head.
Exactly.
On the form, it'll ask you where it came from. And so you can mark on there and I won't look.
No, it doesn't.
It doesn't? It's over on the, no, you have to fill out the form that's in the portal.
Oh,
It's
in the
fine. I'll show you.
portal.
Yeah,
Okay.
I'll show you. That's the
So,
lab form. It's not my form. It's for the lab to be able to run
gotcha.
it.
So Adrienne has a really cool system she uses that I'm probably going to start using. That's
Oh,
so
you
much of
like
her,
it?
yeah, so much of her stuff is right online, so you can
Yeah.
do it right from there. It makes things super simple.
Yeah.
So anyway, so this sample is all ready to go for you.
That's exciting. I
Yeah.
wanted to say, I think it's really interesting, women, when it comes to thyroid disease, because we will put up with a lot of symptoms. Say fatigue, we'll put up with like heartburn, we'll put up with, dry, flaky skin. But the minute it attacks our hair is the minute we'll do something, right?
Yeah.
So that's when we'll go in and say like, okay, well, I've had these symptoms, whatever, but now my vanity is on the line and now we need to do something.
Right?
Right?
You're right. Cause my husband, he's like, he can always tell when I'm stressed out because the drain we'll have more hair in the drain from the shower, and it'll literally, come out in my fingers,
Yes.
and
Yes.
so I think for me, it was kind of like the aging process then too. Like I was starting to get gray and then I'm losing my hair and I'm like, oh God, this is not going well. And then you're like,
it's just not going well.
Then you're like, cut off massive quantities of your hair.
It's not
kidding.
massive quantities.
And
it
I'm like,
equates to like 1 tablespoon, like once, because really, honestly, all we need is like the first inch that grows out of your thing. And so the best thing to do is to lift your hair up, and then in the back, like this is a piece you could pull, right? And you clip it right straight to your head. And then you pull like another piece under. So when you put your hair back down, you can't see it.
You have massive amounts of hair. I can tell.
I have worked really hard. Like, again, I've worked really hard. It was about 6 years ago when I had very, very long hair, and I woke up one morning and it had turned into a Brillo pad.
Oh.
It crunched. Like and it would break off. And then I took a shower and I thought, well, I'll do like a deep condition, and chunks of my hair were falling out. So of course I go to the doctor.
Yeah, right.
And it wasn't until many things later that I figured out the right things to do that my body wanted in order for my hair to grow back to normal. And one of the things that I had to do is I went in and I had all of my hair cut off to my chin, because that's as short as I was willing to go. But the damage that the thyroid, my lack of thyroid medication had done, reached all the way up into obviously the top of my head. So I had to like grow it out. I would like go in every 4 weeks and have it trimmed and trimmed and trimmed. And after about 2 years, my hair lady, who's so amazing, she said, okay, we have new growth. It's beautiful. And you can start growing out your hair. So now I'm like growing it out. And every time I go in, she's like, oh, look at all this hair. Oh, and I just switched my thyroid medication 2 months ago. And you wouldn't believe my hair is growing like a weed. And my nails are too. And I'll tell you, I don't have gray hair. I have white hair. And so I get the white hair coming in after 2 weeks and of having it, refreshed. And I can't handle. I can't handle it. I can't handle it. I go to my hair lady, please. She's like, I can't even tell. I'm like, I don't know. It's all I see.
Oh yeah, my hair grows gray straight from the top, like a fountain of gray.
That's
and
beautiful, though.
But the rest of my hair is not gray, but just this fountain on the top. And I'm like
Cruella?
Yes. Like who needs that? Who needs a fountain of gray on the top of their head? Not this girl, but it is fascinating, talking about the whole thyroid thing and, what we're willing to put up with. I like how you said that, because I think I was willing to put up with a lot of bullshit around it because I didn't know what else to do, right? So you reach your threshold with doctors and specialists and all that. And then you're just like, okay, well, I guess I'll just accept this as my state of being, right? But really what I was accepting is like, I'm in a disease state. Like, like accepting that.
It becomes your new normal. You forget what it feels like to be not sick.
Right. And for me, I talk about this too. Like for me, it was gluten, like getting rid of gluten, like changed my life, like energy levels, everything, so that was pivotal for me. And I will never go back. Yeah. My husband poisoned me once with gluten. Just kidding. He made a stew that he didn't realize that he put some gluten stuff in, and I'm eating it. I'm like, oh, this is so good. This is so good. And he goes, I think there's gluten in that. And I went, 2 days after that, I was like,
oh, yeah.
know,
that's exactly how it affects me too. It also gives me like joint pain. So
right here, it gives me carpal tunnel. Yeah.
Carpal tunnel. Yep. Also dairy. I didn't experience full relief from symptoms until I had eliminated both gluten and dairy. So dairy tends to be that one last link. Most people aren't willing. I mean, getting rid of gluten's easy, right? And in this day and age, you don't have to eat gluten, right? Well, you also don't have to eat dairy, but it's easy enough to eliminate gluten and not feel deprived, I think.
I agree with that, but a lot of people don't.
No, I know, but I found it rather easy because there's so many other foods to eat. But you tell me I have to take away sour cream, which is the whole point of eating tacos, right? It's just a vehicle for sour cream into your mouth.
Exactly.
You take away cheese and you take away cream and your milk and your ice cream. And that, that's almost like, I don't know that I want to live if I can't have sour cream. God. But so it has been, I think it's harder to give up dairy. But once you do and you get past that 30-day mark being dairy-free, it's an amazing world.
But I have to say, I think I felt the same way giving up gluten because, I mean, at that time, there's a lot of pastas and breads and, giving up all of that felt like deprivation until I did it and I felt so much better. And then I thought, that's not deprivation. That was pain. Like I was giving up pain, Yep. And so when the reward of giving it up actually outweighs the reward of eating it, is when you make change around it. So yeah. And I don't even do sometimes I'll get like gluten-free bread if I really want toast with my eggs or something, like as a treat, but it's not like I go out there and replace, all the crazy gluten-free this or that for, don't do that, guys.
No, they call that gluten-free junk food. Yes. And it's no better for you. And actually, while it says gluten-free, they can still have certain levels, parts per million, they call it, in the food and still be called gluten-free because that's how our FDA works. So celiacs definitely should never touch that food. But I don't recommend it at all because you're not really changing your habits. You're just changing the side of the aisle you shop on.
Right, exactly. I love that. All right, let's talk about this test because I want to know what I'm going to find out. So let's get to it.
I love the hair analysis test because for me, it was such a game changer. I had, graduated from ITN, the nutrition school, and was working on my own thyroid issues. And while all of my thyroid numbers were normal, my TSH was crazy. And no amount of changing the medication changed that TSH. And of course, I felt very hypothyroid, all of those symptoms that, are hard to deal with. And it finally got to the point where my own doctor, who was a naturopath, said, why don't you go to our functional nutritionist that we have here and do the hair analysis? I was like, great. I probably should have my own nutritionist, right?
Yes.
Walk the walk, talk the talk. I mean, and I absolutely fell in love with her. And so we did the test and the results came back and I was floored, absolutely floored. The amount of information that it gave and how to best, go forward and try to fix my thyroid. And what it tells you a lot of things. First is metabolic type. So you're either a slow or fast metabolism, but there's different levels. There's slow 1 to 4 and there's fast 1 to 4. And those levels kind of indicate where you're at in distress or, metabolic stress even, adrenal fatigue. So I don't really care if you're a fast metabolizer or a slow metabolizer. That means nothing to me, but those numbers do. The other thing it talks about is your nutritional elements. This is like one of the graphs that you might get. and it talks about calcium, magnesium, zinc, copper, and you know that if one is out of whack, then the other one's going to be out of whack. They all have to work in tandem together.
Right.
So it's like a yin and a yang. So if your copper is too high, that means your zinc's too low. And we have to work to bring everything back to symbiosis. So you're going to feel a lot better.
Mm-hmm.
Also does toxic elements like aluminum, cadmium, lead, arsenic, that kind of thing. So if those are really high, then we can work together to help your body get rid of those, kind of use binding agents to flush them out. And the thing that this does that I love the most is it talks about food allergens, potential food allergens. And this is all just based on your hair. It's so interesting. And I will say that I've done so many of these and no test is alike. They're all very different. So you can get 2 thyroid patients that have the exact same symptoms, but their hair analysis will not look the same. Their food allergies will not look the same. There might be some similarities, but my list looks very different from another thyroid patient's list of foods to avoid. And the foods to avoid will absolutely floor you because there's foods on this list that you would classify as clean or healthy. So for example, I had broccoli is on my do not eat list. Coconut oil, I was bathing in coconut oil, you know, like that was my identity, was coconut oil and apple cider vinegar.
Your identity.
I don't know how not to do coconut oil. Avocados, pork, duck, goose, rutabagas. I don't think I've ever had a rutabaga, but apparently that's something that my body was reacting to.
Hold on, I gotta ask a question. So,
yeah,
is that part of the lab? Is that different than a food sensitivity lab?
it is, because the food sensitivity is blood. So it's going to pull. So with blood work, it's going to tell you what's happening right now with that blood in your body, right? Okay. With hair, it gives you a longer story, right? So it's going to tell you kind of what's been going on for the last 3 months. So that's why it's fascinating. And that's fascinating too with the toxic elements because, you know, toxins they don't live in our blood, right? They find other places to live. But before they find their place to live, they've actually been in these cells that helps grow your hair. And that's why we can get that information. So it's super interesting that I can have a list of foods that I would consider healthy. And even if I were to put a client on the AIP plan, which is the autoimmune protocol, these foods are still on the autoimmune protocol. So you might be thinking you're doing the best thing you can for your client, but really you're missing the mark because they're still eating coconut oil or whatever might be on their list.
Okay, so like I think about this with the food sensitivity stuff. I'm mentioning it because food sensitivity labs are kind of a big deal these days. There's a lot of people that do them. So do you ever introduce these foods back in, or are they just like no-nos forever?
Some are no-nos forever, but there are some that you can add back in after the nutritional therapy program that we go through. And I tell people just give me 30 days because it usually means giving up food that they, you know, absolutely love. When it comes to thyroid patients and their test comes back and says no dairy for you, I say, you know what, let's get you dairy free and we're going to maintain dairy freeness. That's the life you're going to live. But when it comes to like broccoli, you know, in those 30 days, you're going to eliminate broccoli, but we're also working on a gut healing program at the same time. Okay. So if at the end of your 30 days and you say, broccoli, I really, really miss broccoli, I say, great.
Nah, it'll be dairy. It'll be dairy. I'll be honest. I'm not going to miss broccoli too much.
Right? We're going to pretend that someone really wants to put broccoli.
Sure. Keep it up, Adrienne. Let's pretend it's broccoli.
So I'm going to say that's great. You can have broccoli, but just make sure you wait 2 hours after you've eaten something. And then you have to wait another 2 hours before you eat something else. So you're just eating just broccoli.
Got it.
And then you're going to see how you feel. And again, even those foods, I would say it's not something you want to eat every day because obviously your body has in the past reacted to it. And hopefully with the gut healing program that we do, that you re-injure your gut lining because then that will make all the allergies come back. But if we can protect that gut, then you can have your broccoli. 2 times a week
Or never.
or whatever you want. Yeah.
Or never. So if you don't, let's say you don't eat broccoli. I'm asking for a friend. Let's say you don't eat broccoli. Then that wouldn't really show up in your hair though, would it?
It can, just like I said about rutabagas, because I don't know that I've ever eaten a rutabaga.
Okay.
But again, it's just gonna come in, and that's how their test, pops it up for them. So there's maybe something in their testing that says, let's test this person for rutabagas, and for whatever reason, your hair is gonna say
no rutabaga for you.
Yeah.
Right. Mm-hmm.
I mean, have you ever had a rutabaga? I don't know.
Years ago, but yeah, I don't think that would be in my hair anymore. Yeah. So that's weird. That's interesting. All right.
Yeah.
So then what would be your next step would be to a protocol on food or what?
So what I do is I take that whole lab report, and it depends on the person, but it can be anywhere from like 4 to 20 pages long,
Oh, mine will be 20. Mm-hmm.
maybe. So, after that, then I'll sit down and I create, based on your results, a 4-week nutrition plan. And sometimes supplements are included in there too, depending on what your hair analysis looks like. Like if you're adrenal fatigue, like it will let you know if you either are currently in adrenal fatigue or if you've had a past episode of it.
Okay.
So, and that usually means some supplements or in a different way of, eating and lifestyle changes, obviously. But then we go over this, 4-week nutrition plan. Mm-hmm. And as long as you follow it and you don't eat outside of your do not eat list, you're good to go. And if you can just make it that 30 days, and, almost everyone does, because you feel amazing. So after 21 days, you have a whole new epithelial lining of your gut. You have brand new insides basically after 21 days, and people just feel amazing.
So then what happens after that 30 days? Asking for a friend.
Then we meet up again, and we do our follow-up, and I'm going to say, like, how did you feel? And, going forward, let's figure out what we want to do, because you can potentially start adding back in some foods, but following a protocol. And you can stop maybe some of the supplements. Mm-hmm. I do get so there's a doctor that interprets these lab results, right? Because in the state of Oregon, nutritionists cannot interpret lab results. But the doctor will come in and say, like, hey, this person really needs to be rechecked, their hair rechecked in 3 months, or they'll say 6 months. So they'll give us a recommendation to do a recheck going forward and kind of see where you're at. It's interesting because sometimes by doing by changing the way that you eat, it can also change the way your next hair analysis looks. For example, this wasn't my client, but a fellow nutritionist had a client where all of her toxins were way up, but everything else was normal. And so they did all the work, but then she moved, and they redid the hair analysis, and the toxins were great, but everything else was out of whack. How weird is that? Well, it turns out they moved and they stopped going to the grocery store and only shopped at farmers markets, which is great, but it changed everything a little bit. So you just have to kind of be on it and not just say, oh, one and done, and I'll just stay on this forever, because your body changes and we're all very different, and your environment changes and your stress levels change, and,
Right. So I'm really, really excited to do this. I feel like my thyroid is in a decent place, right now, comparatively to where I've been.
Perfect.
So I'm in a really good place and a mindset to be able to do it. Cause I think that's probably the other piece, like making sure that you're in a solid mindset to move forward in something like this, because even 30 days can feel like an eternity if you're not ready for it. You know?
Yeah. I have had a couple of clients where they thought they were ready, and then it came down to it, and it was too much. And that's okay. That's okay. That just means that you're not ready, and we can come back and do it again when you are. So the mental is like, usually when I get clients coming to me, it's because they've been so sick for so long. This is kind of a last resort because their doctor isn't doing anything more other than saying like, your TSH is normal, come back in a year. Well, that doesn't help anybody. So
right.
Yeah.
Right.
So I usually get the people who are like willing to do it, and I'm right there with them, and all good.
I say that a lot. Like, I'm usually the last place that people look for mental health, you know, and, which is fine, because if I'm the last thing that you need, then great, you know, good for you.
Yeah.
Right. Exactly. But unfortunately, because of that, I also get a lot of people that are pretty sick and tired, and they're very tired, and it takes energy to make changes, you know.
It does.
So,
It does. And that's where we come in. You know, we become the cheerleader then. I know they can do it. I know it feels horrible to try and do it, but I know that they can do it. And that's my job, is to help.
Nice.
Push them out.
Come on. Yeah. All right. So anything else you'd like to talk about with this hair tissue mineral analysis?
So you don't want to do it if you are using dandruff shampoo, because that will change the chemistry of the hair.
That's if you use your hair from your head.
If you use the hair from your head and you're using dandruff shampoo, you'll want to wait at least 2 weeks before obtaining a sample to send off to the lab. Abstain from using the shampoo and then wait 2 weeks. Same thing for swimming in pools. If you're like a frequent pool swimmer, maybe go to the lake instead. I don't know what you would do instead, but
not swim in a pool.
Yeah, I wouldn't swim any lakes around here either.
Me either.
And also the last one is hair color. So again, ladies, you just let it grow out for at least 2 weeks, and we just need that little bit to send off.
I was actually wondering about that. That was something that I did not ask. So, but it's okay if your hair is colored, but it just needs to not be a fresh color, is what you're saying.
Yep. Because you get a little bit of that grow out, you know, after 2 weeks, and that's really all we need. Because then I just snip it right off, and that's all the lab wants is the hair closest to your scalp.
Closest to the scalp. All right.
Yep.
Cool. All right. So everybody, this is going to be my journey with Adrienne. So I know, right?
Yes. You can do this.
I feel like it's like thyroid 2.0 for me. Like, you know, I've done a lot of work, and I feel like this is kind of the last work I need to do. So
yeah, I would that's how I feel about my hair analysis. Like I said, whole life turned around. Oh, I didn't finish the story, which is after 30 days of doing my very own, nutrition plan based on my own hair analysis, my TSH, I didn't change medication or anything. My TSH went down to 1.7.
What was it before?
It would bounce between like 7, like the high 7 point something, and 60 something. Like it would be really high.
And so you may not know this, I don't know. Why would something fluctuate like that? So
it's really normal for the TSH to fluctuate a little bit, but you still, when it's fluctuating, you still want it to be within the normal or optimal ranges for you. Obviously for me, it was all over the place. And this gut healing protocol that I put myself on, essentially the grand plan and the big picture is to eliminate inflammation. Right. So inflammation can cause your TSH to be really wonky. And a lot of reasons why is because there's so much inflammation, you're not absorbing any of the nutrients, the micronutrients that your thyroid really needs to work well. You're not converting T4 into T3, which usually happens in the liver. A little bit happens in the gut and a little bit happens in the kidneys, but most of that conversion happens in the liver. And the T4 is what your, thyroid gland pumps out, but T3 is what our cells need. So they have to be converted through the liver. So that conversion rate will go down if there's too much inflammation. Also, if there's too much inflammation, you're not absorbing your medication well.
True. Very true. So that will impact those numbers too.
Absolutely.
And then if you do begin to reduce your inflammation and absorb your medication, is it possible that you might need a medication dosage change once things
because if you've been raising your medication level based on your TSH or whatever levels you're at, And if you do this protocol and decrease your inflammation, you might be getting too much thyroid medication at that point. I do tell most of my clients that, one, share your hair analysis with your thyroid doctor.
Mm-hmm.
And also make sure you get your labs checked after the 30 days on this therapy program.
I will do that.
Yeah.
I will do that. All right, cool.
And you might be really surprised by the results.
Ugh, I might be really surprised. I like good surprises like that. All right. So we will have, again, in the show notes, how you guys can get a hold of Adrienne. And because she is the Thyroid Whisperer, and I am super pumped to do this.
Me too.
Rawr. All right. So I'm not sure where we're gonna have this on. Probably share it across not this episode, but my journey with you.
Okay.
How we want to do that. So everyone stay tuned, and we will let everyone know how we're gonna do that.
I love it.
All right.
I'll be there.
I'll be there too. I'll be there, be square. So, all right. Well, thanks so much for, thanks for joining us again, Adrienne.
Thank you for having me. It's been a pleasure.
And thanks for talking about this hair tissue mineral analysis. It's pretty important stuff, and I cannot wait. All right, everyone, take care and have a good rest of your day.